Hi everyone, good morning from Singapore and welcome to the SDG Innovation Roadshow 2022. We're very pleased and excited to be able to welcome you on AirMeet, for those who are listening to us virtually from all corners of Southeast Asia, but also for those who have come today to the AWS office in Singapore in Asia Square. So my name is Camille. I run the AWS The Startup program in Asia Pacific. I'm part of the AWS Public Sector Partners team, and we have curated and prepared a very exciting program for you today. Before we roll out the agenda and we tell you what we're going to cover today, let me first explain why we're doing this Innovation Roadshow. As you may know, Amazon has launched a new leadership principle that is called Success and Scale Bring Broad Responsibility. And that principle basically embeds sustainable development as part of Amazon long-term strategy. And that comes on top of the climate pledge that Amazon has done to reach net zero carbon emission by 2040. But as you may know, sustainable development is not all about carbon emissions and recycling waste. And the United Nations has launched a very ambitious agenda, the 2030 agenda, that is covering a lot more things, such as education, health, social peace, inequality, a lot of elements related to sustainable development that we at AWS wants to tackle and provide solutions for. And that's the very purpose of that initiative. We want to raise awareness about this, and then we also want to empower change makers to bring those ideas to life and tackle some of the world's biggest problems. So what is the SDG Innovation Roadshow in essence? Well, it's a partnership between the Startup Buddy and AWS. We're pulling our resources together so that you can, innovators, startup founders can benefit from technical resources, business trainings, mentorship, connections to investors, and a platform to connect with other organizations, public, private companies as well, that are embracing SDGs as part of their mission. So that provides an avenue and a platform to access those resources. And the SDG Innovation Roadshow is also a dialogue, a communication platform to learn about SDGs and see how cloud innovations can provide solutions to tackle all of those problems. So today we're starting with a regional inauguration, but then we will start a caravan that is going to travel across Asia Pacific. We will go to Korea, we will go to other ASEAN countries, we will cover Australia as well and Japan. So this is the start of a very exciting journey where we'll be able to engage with a lot more founders as well at the grassroots level.
Oh, sorry. Okay, so everyone, my name is Robin. Something's going wrong on my screen because I'm too far from the screen. Ah, crap. I'm going to talk you through the program for today. So we have a very long program, as you can see. First of all, before I go into the program itself, I'm really sorry about this, guys.
There we go, we're back.
Okay. So I'm not going to talk you through in total detail, but we have a lot of very cool speakers today. We have Callum Handford from UNDP sharing a lot of knowledge about the Sustainability Development Goals, how they relate to digitalization, his experience in implementing that worldwide. We have a lot of startups. We have Kabloom from the US, which is very interesting edtech. We have multiple health tech startups. We basically have a health tech startup panel and an educational tech startup panel. You can see the different companies that will come along here on the schedule. Then, of course, there's going to be networking, both online and offline. We'll have 3 different rounds of networking, each time 15 minutes. And in between, if at any point you need any support from for any reason, just make sure to go into the chat on AirMeet and reach out to Rishav, Darvis, Faize, or maybe some other people that you have noticed are from AWS. So Clara, Andre, and Sam are from AWS are here in the room here on location and can help you with everything as well. The program is scheduled to be online till about 1:30 this afternoon. You can also use the virtual networking sessions to have a little bit of a break if you want to. And for the people over there in the room, I'm pointing that way. Over there in the room, just reach out to whoever has got an Amazon shirt to help you out for today. So this event is supported by two partners. Thank you very much, Globalization Partners and Cognis. So Globalization Partners will be doing a lunch sharing session later on at the end of the online program. Cognis is a startup based out of Australia and has been helping us reaching out to many more people here. Both of you, thank you very much for your support and for supporting the SDG Innovation Roadshow. And then we go to Gina.
Good morning. I'm a startup program manager at AWS covering APJ as Camille, and I cover a program called Startup Ramp, and it is a startup program derived from a AWS public sector. I'm going to define the public sector from AWS perspective to make it clear. AWS has different business units based on the industry focus, so we could provide customers with better industry focused knowledge and experience, and public sector is one of the pillar with the commercial sector. And in public sector, we have two startup programs called Startup Ramp and EdStart. EdStart, as you can see from the name, is focusing on education, which is the part of the SDG goal that we're going to cover today. So EdStart is supporting edutech startups, while Startup Ramp is covering the rest of public sector, which is deriving from like health tech, space tech, gov tech, agri, smart cities, civil engagement, and even nonprofit organizations. So if you can think of any startup who is providing solution not to an individual consumer, but to a more broader like public citizen for the public good, that will fall under Startup Ramp. And if you have any question, you can always ask me. So I'm gonna double down on what we can offer from those startup programs. Those benefits are identical for EdStart and Startup Ramp. We provide startup with financial benefit, which comes out in the form of AWS promotional credit. It is like a coupon that you could use to cut down your AWS bill when you use AWS service. And apart from the very first amount of the credit that you will get when you apply for the program, if you have any other like POC with the customer, that funding can be additional for the POC funding. Another big pillar of the benefit is technical support. We provide monthly webinar. It usually happens at the last week of every month. We pick the topic amongst the service that the previous startup members are using the most, or the new AWS service launched recently that could be beneficial for the startup to learn. And also, if you are more interested in to dive deep in one specific technical feature, we can arrange a customized training for you, like one-to-one. We offer office hour as well. You can walk into the virtual meeting room to ask for questions. And more like technical support can be brought up in a form of architecture review or cost optimization for you. There's also a go-to-market part of it. If you want to like enhance your visibility, AWS is the place to go because we have global outreach. If you're featured in our blog, or we can do the PR activity together, or you can even speak at the AWS event like Summit or any other like customer-facing event. So you could tell your story to the customer, go to market with AWS. The final thing that I want to focus here is community part. Since Start has been there for what, 4 years now?
Mhm.
And Startup Ramp is a fairly new program, but we are trying to build a community of startups who can share their knowledge, share their stories, and also provide some mentorship to each other. And one final thing can be like we could have a group of events for like pitching competition, not like a competition, but pitching day, and also like connection with investor.
Mhm.
So that's about our programs.
Mhm.
And you might wonder, so how can I get all those benefits? This is the QR code that will direct you to Startup Buddy page, where you could put in the program codes there, AWS EdStart 2022, AWS Startup Ramp 22. Then it will direct to the AWS page where you can apply for the program. In that case, you're not only getting the AWS Startup Program support, but also Startup Buddy support.
I think that's the perfect bridge to go to me facilitating.
Yeah,
let's do it.
Go
Let's do it.
on.
Everyone, so we're gonna take 5 minutes to do a quick fireside chat with Gina and Camille. In the meantime, if you have any questions about the programs or anything that we're gonna do for the Innovation Roadshow, or basically anything you want to know, I'm gonna be selective on the questions that I pick or not. Please put them in the Q&A. You should see a Q&A section on the top right side of your screen. Just type them in there, and in a few minutes I will go through there and we'll pick a couple of questions for Camille and Gina to cover. So Camille, the EdStart program is very unique in that there's not many similar programs that have such a wide reach across so many countries. Have you already noticed some differences or things that are done differently, for example, in Indonesia compared to, I don't know, Korea, working with the EdStart companies in your program?
Yeah, I mean, we build very close relationship with edtech founders in our program. So we really create benefits, according to what they are asking support, on. So Asia Pacific is such a broad territory, right? And I usually look at it in 3 sub-regions. So there would be Australia and New Zealand, and Northeast Asia, so Korea and Japan. Those are more mature kind of like edtech markets. So the type of requests that we get from founders over there are mostly about scaling. So scaling the business, or also kind of like outreach to kind of like global VC. They're already kind of like quite well versed in terms of like AI, machine learning, blockchain, AR, VR, this type of technology. So I think what they're looking for is really international market expansion, right? When we look at ASEAN, Southeast Asia per se, more support is actually catered around venture building. So how can we help those startups, those founders who have their initial go-to-market approach, but also how they should be able to better prepare for the fundraising efforts as well. So different type of kind of like solutions that are created for different type of markets, and also different set of needs from one founder to another, depending on wherever they're coming from.
Yeah. Okay. Thank you very much. Gina, actually to follow up on what Camille was saying, so cloud solutions are now very omnipresent. Probably most startups are using them in one way or another. I know from personal experience, even though it's now way easier than 30 years ago, when you have no experience in setting that up, it can still be quite complicated. What do founders, startup entrepreneurs, everybody in the space who is actually part of the Startup Ramp or Start program get in terms of support from AWS to make that easier? Like, can you give a couple of examples?
Yeah, sure. Actually, we accept a lot of early stage startups. So for those very early stage startup who has ideas but not yet developed anything, or in the midst of developing anything, we provide training in 101 level. We actually cover in this training session the full stack of services from like compute, storage, database, analytics, you name it. So they could know what kind of services are available like out there, and what can they do with that. We actually like often compare the web service as Lego blocks. So we show them what blocks are there and how they can build with it. And also we share use cases with the startups so they could like learn from each other Another thing is that we are trying to, build a mentorship program so they could have, a more like, how can I say, the ones that has gone through that path already can come provide some technical advice, not only technical advice, but also the business guidance, because business guidance using the cloud could be a little bit different from using some other technology. So that's how we nurture those startups who are in a very early stage of cloud usage.
Yeah. We are happy to be part of the Head Start program with the Startup Buddy, and we have already leveraged quite a bit on the support, so I can very much recommend it. Camille, so the sustainability development goals are covered regularly throughout today and the coming events of the Innovation Roadshow.
Yeah.
How do you feel that cloud technology helps progress the development of those goals, specifically in your case in the educational space?
Sure, of course. Well, I'll probably give an answer that's specific to education technology. I think one of the things that we really insist on with our founders in our program is around the pedagogical approach, because that's something that's very specific, in terms of like EdTech. So spending time for those founders to figure out their teaching strategy or instructional kind of like strategies and how they can operationalize that in terms of like learning activities. And this is where cloud technology comes into play, because that's how you're going to define how you're going to use different type of like learning technologies and tools powered by cloud to deliver that content, deliver those solutions at scale throughout the region in a way that's meaningful for learners. So that's something that's very important in terms of engagement, in terms of latency, all of those elements that are very important to maximize the learning outcomes and basically help the teachers on the ground to do a better job and empowering basically in their classroom their students to do things that they would not be able to do if they were not using a SaaS solution, for instance. Yeah.
Okay. We're going really fast with the time, so I'm gonna skip right away to the Q&A. For everyone on the other side of the line, if you're wondering why I'm doing this difficult, it's because my eyes are not good enough to read the questions. We have a question from you. His question is for Gina. Do we need to be part of Startup Ramp to participate in the monthly webinars technical office hours?
Yes, please. It's not going to be too difficult to apply. You could just tag on that, QR code. We are going to show that QR code later in the day. But then again, you could also go into the Startup Buddy website, and there is a section that you could automatically go to the application form for the Startup Ramp or at Start. So if you do that, all the benefits are there for you.
One thing that I would like to add on is both of our programs are equity free. So for us, the bottom line is really to help the startups become successful. So what we do is that we raise technical debt. We provide you with a runway as long as it's needed to take your solution off the ground and generate enough revenue to become a sustainable business, right? So feel free to apply. We're here in the long run to help you out. And at the end of the day, it's a win-win relationship where you have built an amazing solutions, you're leveraging all of AWS kind of capabilities, and we are growing together.
Thank you. We're going to the last question because we have amazing speakers waiting. This question is by Rick Chen to all speakers. Besides the standard pitch techniques, how do we stand out from other pitchers? Say unique ideas related to our product relevant to the industry.
Whoa.
Who wants to take it?
I'll take a stab at it. I think if you're a founder, it's all about your story. At the end of the day, building a startup from the ground up is a very difficult thing to do. And what makes the difference is your passion and what is the cause basically that's behind all of this. What is going to motivate you every morning, to wake up and fight that fight until your startup becomes successful. And at the end of the day, as the founder, that DNA is going to transpire in your solution as well. So your personal story as a founder and the solution that you're building should be very much aligned. And as you pitch that should come across. So obviously for your customers, but also to investors and anybody in the audience really who's going to listen to you.
Okay. Thank you very much. I think with that, we're going to close off this section. Gina and Camille, thank you very much.
Thank you.
First of all, for just now, and also for making the Innovation Roadshow possible in general. With that, I really like to invite the first speakers to come on the stage, which is going to be Calum and Monique. They're going to be talking about the sustainability development goals in general. Monique is facilitating that session. Calum is a very interesting speaker. I'm going to wait for a second till I see you guys appear on the stage. If there's anything, just put it on the side channel, then we'll help you. In the meantime, while I'm checking what's going on, if some of you might have seen that on the top right side, there's actually a leaderboard option on AirMeet. That leaderboard is used for who's asking most questions, who's networking a lot today throughout the sessions. And there's going to be prizes. What the prizes are, I'm going to tell you a little bit later on. But other than that, obviously, you have a more fun experience. You meet more people. You have a more interesting session. There's also going to be prizes, so make sure that you ask whatever you like to know. If you want to follow up with Camille and Gina, they're going to be around all day. There's a chat function, so just ping them directly or connect later to them for the networking. Rishav, can you let me know what? Calum and Monique, yeah, you should join backstage. So push the button that says go backstage. Nothing else. Or otherwise, Rishav, invite them on the stage, please.
Maybe in the meantime, we can take a question.
Yeah, sure. Okay. There is another question, so we'll go to the other question for a second. Thank you in advance for holding an extraordinary and very useful activity. Thank you. For an early stage startup like us. Oh yes, I want to know what are the benefits that we can get besides knowledge and networking from this event. Thank you. This question is by Armando Orlan. Maybe Gina?
Well, as Robin just said, if you check the leaderboard constantly, you will get to know whether you're eligible for the prizes, for one thing. And knowledge and networking, that is the main like benefit that we could provide. But you will get more to come if we could join the program, either at Start or Startup Ramp and Startup Buddy. So yeah, it's a kind of a, you know, like a pre-show before we're getting you to more benefits.
Yeah, absolutely. So that's, think of it as a highway and accelerated access to our programs. Basically, we are running out the red carpet for you to join our program today.
And I think in the meantime, Monique and Calum have joined. So Monique, I'm gonna hand over the reins for the session to you and to Calum.
Great, thanks. Can everyone hear me? Thank you so much, everyone. So welcome. I'm really excited to be part of this. So my name is Monique Biancu, and I lead the AWS Institute here in the region. The AWS Institute is a thought leadership and executive education program that helps the public sector accelerate in their digital transformation space. So we have a really special guest with us for this fireside chat around technology and SDG goals. We're going to have a few minutes at the end to answer any questions. I'm sure you're going to have a ton of questions for Calum, so please be sure to put them in the Q&A as we go along. So I'm really excited to have with us Calum Hanforth. He's from the United Nations Development Program. He is an advisor to the UN the UNDP's Global Center for Technology, Innovation, and Sustainable Development. He's has a ton of experience. He's led innovation, digitalization, and smart cities programs all around the world. He's shaped um, developments of like numerous digital innovation initiatives, drafted and led legislations, policies, strategies, advised governments all around the world. He's co-chair of the Digital Infrastructure Task Force, World Economic Forum, G20. I can go on and on and on. So first of all, Callum, thank you so much for joining us. I wanted to first kind of ask you to help explain a little bit more about UNDP Singapore's Global Center for Technology, Innovation, and Sustainable Development, because I think a lot of us are familiar with UNDP, but not so much this center.
Thanks, Monique, and it's great to be here. So from our side, the UN Development Programme, we have country offices in about 170 countries and territories around the world. And then we have a small network of global centres. So I work at the UNDP Global Centre here in Singapore. But actually, a lot of our work is outside of Singapore, so largely across Sub-Saharan Africa, Latin America, South and Southeast Asia, and also into the Pacific as well, with small island developing states. And our work largely focuses on three main areas. The first is providing technical advice to governments, to the private sector, to partners around the world, to implement the Sustainable Development Goals and leverage technology and innovation. The second elements like today, so partnership brokering, finding new and exciting innovations and innovators to bring into countries and to connect to our kind of local partners on the ground. And then the third element is a bit more normative. So how do we make technology and innovation a truly global conversation? So for example, if we look at something like smart cities, it's how do we move beyond focusing just on high tech? So not just things like 5G and AI, but things like nature-based solutions, behavior change, and frugal innovation. And then similarly with technology more broadly, how do we make it a truly global conversation? So it's not just a handful of countries or a handful of organizations leading things like technical development, technical standards, and implementation as well.
That's great. Really exciting work you guys are doing. So this Fireside Chat is around technology and SDG goals. I wanted to kind of just set the stage a bit. I think most of us are familiar with the 2030 Agenda for Sustainable Development and how that provides this shared blueprint for sustainability and prosperity for people and planet. And then at the crux of that are these 17 SDG goals, right? That they're kind of at the heart, and is this urgent call for all of us to kind of partner together to figure out, right, ways to achieve a more sustainable future. Can you share and talk about, how and why technology is important to accelerate progress to achieve the SDG goals by 2030? Because we're almost there.
We are indeed. So in the UN system, UNDP is a kind of official steward or shepherd of all 17 SDGs. So we play a really exciting mobilization role across all 17. And sadly as well, with the COVID context, we've seen regression or reversal or even entrenchment of a lot of challenges around the SDGs. We've seen the first global increase in poverty for almost 2 decades because of COVID-19. So again, 2030 is looking a lot closer than I think it did a few years ago. For what we see though, technology is really crucial for all 17 of the SDGs. So from some of the work that we do at UNDP, there's elements like digital identity and digital public services, which is SDG 16, innovations like vertical farming, which are really important for SDG 2 about improving and reducing hunger, health and education, technology and solutions for SDGs 3 and 4. And also because the SDGs are all connected, we see that technology has a really exciting and a really important and enormous multiplier role as well. So fundamentally, we see that technology can build new solutions to tackle the SDGs and to lead to more positive outcomes. It can also lead to bigger and better outcomes more broadly, including building on innovations that we've seen in the past, including more lower tech innovations as well. What we see in many of the countries that we work in, and something I can talk to you later, is that technology can also get to the furthest parts and the most marginalized communities, places that sometimes government and other entities can't get to. The private sector, technology and innovation can sometimes really reach in very new and exciting ways. There's a slightly broader challenge though in the context of technology though, and it kind of leads to that point about marginalization. We do see technology sometimes posing challenges for the SDGs. So there are still real issues of things like inclusion, access, affordability, the digital divide, which is something that we're really focusing on tackling at UNDP and with partnerships as well. But we do see fundamentally that technology is a really crucial asset and tool for the SDGs.
No, that's great. Here at AWS, we feel the same way. Can you maybe talk about, the types of the new opportunities that kind of bring digitalization into these diverse sectors? I know UNDP here, you guys work a lot around health, particularly you mentioned around COVID. Can you share with the audience some of the cool new things you guys have been doing with technology and addressing that gap you were talking about?
Of course, yeah. So COVID-19, I think, highlighted that digital is no longer optional for countries or other partners. It's a really key tool for public and private service delivery, and it's something we've been engaging with more and more in the past few years. So we hear a lot about emerging technologies, so things like AI, blockchain, big data. These have enormous value. And right now, for example, we're doing some work with big data to better target social support for very marginalized populations. So, how can we identify poverty and tackle it in a more meaningful and I guess more efficient way? We're also using things like AI to tackle misinformation and disinformation, and can walk through that in a bit later as well. And then a few years ago, we also worked in Ecuador on a blockchain-driven chocolate bar to improve kind of farmer income. But beyond the kind of high tech, there's also a lot of stuff that we're doing around more exciting, other exciting tools, including more frugal innovation. So, for example, things like 3D printing, we're exploring in a number of countries in terms of how do we redesign supply chains, build resilience, build local entrepreneurship as well. But I think cross-cutting all the countries in which we work, there's a really exciting opportunity in the context of digital, which is about lowering barriers to entry, including for local developers and local innovators. We still see real structural issues of access, so things like affordability and skills, but also another barrier is about relevance. So building content and services locally, so with and by the people who need them most. And I think this is where it's really exciting about these kind of lower barriers to entry, because we can also build the next generation of innovators as well. So we do a lot of work with things like girls coding camps to get girls engaged in STEM education and STEM opportunities. A lot of work around entrepreneurship development, shaping innovation ecosystems, working with many of the kind of startups and other partners that we have in the room today. And we see this as really kind of hugely important opportunities to really make digital inclusive and successful around the world.
That's really great. So, building on that startups, how do you see, a lot of the people in our audience today are startups. How do you see working with them to kind of help meet these SDG goals?
Of course. So I think there's a few areas to that. The first is that we see startups are really crucial for success. As I mentioned earlier, technology is a really key tool for the SDGs. And also you're all tech and innovation leaders by virtue of being here as well. So we're very keen to work with you and learn from you as well. Related to that as well, your customers and your populations much better than anyone else. You're in communities doing the human-centered design, you're piloting, you're iterating, you're scaling. You have phenomenal knowledge and expertise that we're very keen to learn from and tap into. As I also mentioned earlier, you can also get to places where others can't. We work in some of the most challenging last mile contexts around the world. And even in some of those in some of those areas, you can still buy a SIM card, you can still engage with the private sector. So it's for us really exciting how far that technology and innovators can actually get to in many of these places, and also finding ways to sustainably and meaningfully deliver really essential and important services. I think more broadly as well. Oh, sorry.
No. Go ahead, please. Would love to kind of hear more. I think because our audience is startups, and just kind of advice you may have from them. I know from your experience, you worked a lot with startups.
Yeah.
How do we kind of create this, ecosystem, AWS, UNDP, and the different multilateral organizations, as well as the startup community?
Definitely. I think the big thing is events like the one today. So for us, it's very much a dialogue. So we're really, really keen to learn from you. As I mentioned earlier, we work with governments around the world who really want to build local, national, regional, global digital economies and innovation ecosystems. But so we need to really understand what is and isn't working in the place that you're working. So where are you encountering barriers or challenges? What are the kind of catalysts that you need for your innovation, whether it's things like open data, financing, building the digital literacy of your customers or others, maybe better engagement with the public sector, with policy experts. For us, the SDGs are all about partnership, including SDG 17, which is fundamentally about partnership. So we want to learn from you. We want to support you and actually understand how we can work together as well.
That's great. I cannot not ask a question about cloud, right? We're AWS, right? So how do you see kind of you talked about all this other technology, and these emerging technologies, there's tons, right? AI, IoT, blockchain, but how do you see specifically cloud kind of create these new opportunities to overcome these inequalities, promote sustainability, and kind of create these new pathways to empowering everyone?
Definitely. Yeah, no, I did figure a cloud question would come up. So I think, again, this is where the lower barriers to entry for us is really, really exciting. In many of the countries that we're working with, there historically has been a lack of physical infrastructure. and often real issues getting access to it. It could be things like affordability, it could be structural issues like tariffs and import restrictions, could be other challenges like electricity and so on. So for us, cloud is really, really exciting as it can make really phenomenal technology power available to many, many more people. And also, it's also solution agnostic to some extent, so relevant to all the SDGs. I mentioned we work in very rural and last mile settings. Often the only tool that we use there is mobile technology, and cloud plays a really cool role there. But we're also working on really kind of cutting edge solutions, things like IoT, big data, AI. And again, cloud is really exciting in that context too. We're also doing a lot more work with governments, so policymakers, and cloud there is quite democratizing in the sense of making things like Python and other elements available, big data processing where we couldn't do it before. There are still some challenges with cloud. So for example, things like environmental impact and around data centers and the practicalities of cross-border data and other sharing. But we're working on those. We see really exciting potential. And in the countries that we're working in, we're seeing some really exciting success stories in the context of cloud as well.
Oh, that's great. I was just going to remind everybody to ask any questions. Feel free. You've got Callum here, a wealth of knowledge. Feel free to ask questions. I have one in particular. So just for people who don't, you've been all over the world. You've worked in Africa, you've worked in EMEA, and now you're in this region, our region, Asia Pacific. Looking at all the work you've done, what kind of excites you about this region and technology and SDG?
It's a really good question. So I think there's a few angles to it. Firstly, it's a hugely dynamic region. There's so much going on, real kind of innovation imperatives, and a lot of different contexts to work in, different stages of progress, but all very, very exciting. I think the interesting element here is just how exciting the kind of regional story is in terms of countries working closer together. So the kind of whole ASEAN piece is very interesting for us. How can we work with countries in partnership and bring a kind of regional approach to some of these challenges, and including cloud in terms of regional approaches in that context too. We also see huge digital literacy in the region. Even though there are challenges of inclusion and access, the levels of digital literacy in many countries are really high. So again, huge opportunities to kind of build on if you're an innovator and so on. And then I guess finally as well, just the innovation ecosystem here is fascinating. Like we see in every country, entrepreneurs, startups, later stage startups as well, just driving really exciting solutions, tackling some of the most important problems. And we're really keen to work with you all too.
Wonderful. No, same for me. I love this region. It's that hustle kind of mentality. And but thank you so much. I don't know if anybody, you can kind of come off mic or put in some questions. But if not, wanted to ask, one kind of final one. If you, as we kind of close out the fireside, what would be some, kind of encouraging words you can give to our startups to kind of, encouraging words about, more technology and SDG and, how they can really help us achieve this before 2030.
Yeah, not sure I'm the most aspiring speaker, but I think there's two things that come up. The first is I think just fundamentally just keep doing what you're doing. Events like this, communities like this are really important for sharing knowledge, networking, building those relationships that are really exciting. I think the second is just to reaffirm how essential the private sector for us is as a partner for the SDGs. To get to the markets that we need to get to get to the customers and the citizens, we need the private sector. So things like sustainability, innovative business models and so on are really essential tools in getting there. So don't feel that the SDGs as just about government, civil society and other elements like the UN. It's also fundamentally about the private sector. So keep doing what you're doing, focus on building business models that get to everyone, and also keep in touch. And if we can find ways to work with you, very keen to do so.
Great. There is a question. I'm sorry if I can take another minute. From Alan, what are you seeing that governments are doing and acting differently than say 5 years ago? Example, thinking green rather than coal.
Thanks, Alan. Really good question. So I think COVID has been a real catalyst for this. As I mentioned earlier, it's made digital no longer optional. It's a fundamental tool of public service delivery. So we're seeing governments engage more in that context, definitely. I think we're also seeing in many places a longer term perspective, recognizing that these kind of investments and opportunities don't take 2 months, 6 months, a year. These are 5, 10, 15-year challenges. And we see many governments, particularly in the region, that they are taking that kind of longer term perspective to working with innovators as well. So how do they build national strategies, whether digital or broader development ones? We also work very closely with governments on shaping those too. So that kind of longer term perspective, I think, has been really exciting for us to see.
Great. Okay, I'm going to keep you on for one more second for Rick, who just had a question come in. Okay, if that's okay. How is optimizing cargo space in the maritime industry linked to SDG goals? So I don't know if you're an expert on maritime cargo.
I'm not. I can say that with some confidence. What we do see though is that so supply chains were hugely impacted by COVID, and still are. Like the cost of shipping is still hugely expensive compared to where it was a handful of years ago. So we do see real importance of kind of tackling and improving efficiencies in that sector. I think what we see is important is how do we build transparency into some of these supply chains? How do we get access to data to understand where the blockages are, where the inefficiencies are? And we see some really cool startups working on that. Actually, here in Singapore, the Port Authority has a really exciting incubator program that works on exactly these issues. So working on things like that we see as really exciting and really important. And then similarly as well, how do we build on a kind of national level the kind of resilience to make sure when these inefficiencies come up, that domestic economies aren't affected either.
Okay, I don't know if we have time for one more before Sam kicks me off, but there is something that came in. Is that okay, Sam? What is one of the biggest public health success you have seen with easier low-cost data sharing and access that the UNDP has worked on? I particularly wanted to ask this will be the last question because you work so much on health.
Yeah, I think one of the biggest ones we've seen is actually in our country office in India, where we've been working there with the government on actually rolling out vaccinations. So building a hugely important platform that's got vaccination to more than 1 billion people. So all of this was founded on openness, on transparency, on open source solutions as well. And so that's been an enormous catalyst to actually making this happen. Not low cost, but I think we've made it as streamlined and as efficient as possible. And we're also looking to recognize it as a digital public good so we can take it into other countries around the world too.
Great. I can go on and on, but thank you so much, Callum, as always. Wonderful to have you. I'll hand it back to you, Sam, but thank you so much. Thanks, everyone, for all your great questions.
Thanks, everyone. Take care.
Thanks.
I wasn't going to jump in at all. I think we'll go straight to Alan or to Robin next. But for people in the room here, we're just working through this. But for the next session onwards, when you see my name pop up at the side of the screen, that means you guys can grab the mic from me and ask questions to the people who are not in the room. So we didn't want everyone to have virtual questions. So for the next session onwards, just come to the front or I'll pass the mic and you ask physical questions to the virtual world. That's all I have to say. Yeah.
Hi everyone. I think there was a little bit of a misunderstanding between the previous speakers and Sam. Sam, we couldn't really hear you very clearly, so I think Calum might have missed your question. Maybe you can put it in the Q&A and Calum has time to come back for 1 or 2 minutes. Let me see on the chat. Okay. In that case, we're going to continue the program. We're going to go to the next speaker, Simin. Facilitator for this session is going to be Gina. Simin, if you can, in the meantime, join backstage and here in front of the cameras, then we can go to your super interesting talk. In the meantime, I'm a little bit out of frame, I'm aware. but please do start typing your questions already early, because the more questions we have, the earlier we actually start with asking them. So if you put them in last minute, the facilitators have whole lists. I'll show you whole lists of questions like that. But we prefer to actually go through the questions that you have. Simin, in the meantime, if you have any problems, so you have to go to the top of your screen where it says go backstage and click that button, or Rishav, just invite her on stage, please. Simin, there is no link. You just click on the button. Or Rishav, please just invite her so she gets a warning to join. Yes.
There she is.
There you are.
Hello, Simin.
Your camera at the moment is still switched off, it seems. Yes, we're getting image. No, we're not.
Okay, sorry, just give me 1 second. I'm just gonna exit and try to figure this out. 1 second. It was working just a few minutes ago.
No worries. Yep, you're back.
Cool.
But not on
And
screen yet.
my video is not working. Sorry, just give me 1 second.
In the meantime, if anyone has a question about anything else, just let us know. We can answer that in the meantime, so we
Okay.
need a little bit of time to set up our presentation. Tell me if you need help, Simin, and I'll talk you through it.
Sure. I'm just gonna try joining from another link.
Okay, what I will do in the meantime, because then Simin doesn't need to stress, and then later on I can save a little bit of time on this. I will explain you already. Okay, Simin is there. Okay, then I won't explain how the virtual networking is going to work.
Hey, we've been waiting. You keep us hanging.
Now,
But my speaker is here. Thank you, Simin, for joining us today. And people, this is Simin, who's going to deliver an amazing speech on how cloud can help solve the challenges in health tech. Simin is a senior strategy consultant at Access Health International. Access Health is a think tank and an implementation partner who can make sure to, provide access of high quality healthcare for everyone. And over to you, Simin, if you're ready.
Thank you. Can I check that you're able to see my screen?
Yeah, we cannot yet.
Can you see the presentation?
No, not yet.
Not yet.
Okay. Sorry.
No worries.
Now?
Screen? Yeah,
There you go.
perfect.
Awesome. Great. Thank you, everyone, for your patience. I'm Simin Mirza. As Gina kindly introduced me, I'm very happy to be here. Access Health works with governments, advisory partners, with healthcare stakeholders, and other industry stakeholders to provide solutions towards our goal, our vision, which is of enabling access to high quality and affordable healthcare to everyone. So thank you for joining me today. I'll just get started with the theme for today, which is SDG 3, good health and well-being. So just to say what this SDG 3 states is that ensuring healthy lives and promoting well-being at all ages is essential to sustainable development. And there are a number of goals that have been defined under SDG 3, but I am going to just share a couple of them that are very relevant to us in the Asia Pacific region. So one of them is enabling achieving universal health coverage. So what this would be is to reduce the financial impact of healthcare on people, on patients, and enabling access to high quality, safe medicine and healthcare services. It is to increase health financing and the development of healthcare workforce. It is to, when we look at diseases, it is to end epidemics, and it is to reduce the mortality of non-communicable diseases. Now, all of these are very relevant. And just before I go into my next slide, I do want to share that last year, Access Health worked together with AWS in carrying out a study that looked at how cloud adoption is taking place across 12 Asia Pacific countries, and what are the barriers that are in the way of cloud adoption, and how are some ways that policymakers can work towards overcoming these barriers. Now, why did we look at cloud? Why is cloud important? Callum addressed some of that before, but I just want to say in terms of the healthcare landscape, cloud is an essential building block of digital health and health tech solutions. So that is why we looked at cloud and how it was being adopted across these 12 countries, which was in many varying stages. But now I want to show you one more finding from this report, which is what are the key areas of healthcare that can be addressed by the cloud. And these are the key challenges in Asia Pacific: the aging population, the increased healthcare expenditure and out-of-pocket spending. This is at an average of 49% of total healthcare expenditure. We have a lack of healthcare personnel and infrastructure. There's in ASEAN alone, their doctors and nurses are there's a 700,000 shortage recorded of doctors and nurses. And then there has been a significant increase in the disease burden, especially non-communicable diseases. So diabetes, hypertension, all of these are leading causes of an increase in the disease burden. So these are all challenges that we found can be addressed by health tech solutions. So now I want to just move towards what the pandemic has done during the past 2 years. And while this impact is shown globally here, it is also relevant to the Asia Pacific region. The pandemic has halted or reversed progress in health, and it has shortened life expectancy. These are graphics taken from the UN Stats report that was published in 2021. 90% of countries are still reporting disruptions to essential health services. And then we've seen that health workers are in short supply. We've seen that a decade of progress in reproductive health, maternal health, child health could be stalled or reversed just because of the pandemic. So what is the conclusion? The conclusion is that there is an essential need to scale up the investment in universal health coverage. And this is where health tech has a huge role to play. And I'm just going to take you in the next few slides through the many different ways that cloud-powered health tech solutions can increase universal health coverage, can reduce or mitigate the challenges that I listed that are currently the top challenges in Asia Pacific in healthcare. So how do cloud-powered health tech solutions benefit? They benefit the health systems at 3 levels. First, at the health system as a whole, then to healthcare organizations, and then to patients individually. So the cloud has a host, cloud-powered health tech solutions have a host of benefits. Now, I'm going to take you through some of the benefits to health systems. Let's begin with medical research, genomics. Now, this is an area that is still coming up. It is still being explored, especially genomics. But what this will lead to is personalized individual healthcare. The cloud has massive computing and data storage capabilities that help with carrying out medical research, with collaboration across countries, and then drug discovery. So there are these benefits. Then let's look at population health management. I think all of us know through COVID-19 how data was collected from the village level, town level, city level, and collated across countries, across continents. And and governments were able to use this data. Organizations like the WHO were able to use this data to come up with strategies to combat such a pandemic. So population health management. Then let's look at diagnostic or screening support. Artificial intelligence, machine learning types of solutions built on the cloud can help in reducing the effort of healthcare staff in screening diabetic populations. Let's look at health data exchange, for example. Now, the cloud is a key enabler of interoperability. It helps health systems in different parts of a region talk to each other or within a network. So health data exchange and solutions built on these can help what are fragmented healthcare systems talk to each other and enable better analytics of healthcare data. And then let's look at the payment side of it. Who pays for healthcare? How do we improve? How do we bring efficiency in those systems? So cloud-powered health tech solutions that support payments, that support insurance solutions can use AI and other data-powered tools to carry out user verification, claims management or claims processing, fraud detection. So all of these issues that are causing a leakage or wastage of healthcare resources can be supported by the cloud. Then let's look at connected patient care. One of the key benefits of the cloud through the connection of different systems is that a patient's healthcare data can be accessible from anywhere. And then let's look at logistics management. So logistics management became very important during COVID-19, as we've all seen, where the supply chains of vaccines became very important or critical to ensuring that vaccination status or targets were achieved. So it's not only just vaccines, but medicines, all of these. How do you know exactly where supplies are? How do you predict whether supplies will be adequate for your current campaigns? So all of these can be enabled by cloud-powered health tech solutions. So I have a couple of examples here that I'm just going to quickly go through. The Thai Ministry of Public Health uses imaging at public sanitation or public toilets to scan for places where there might be a chance of gastrointestinal epidemics emerging, and then it is able to take action quickly. Another example would be the Vector Observatory in Asia that has used Illumina's cloud-based genomic solutions. The Vector Observatory aims to reduce the impact of the malaria epidemics. And one of the ways that they're doing this is to identify where drug-resistant malaria parasites are emerging and spreading. So they use the data storage and computing capabilities of the cloud to process genomic data and DNA sequences. Then we've seen how digital health tools, contact tracing, testing, telehealth, all have emerged during the pandemic. These are all based on the cloud. Now I will go to the benefits to healthcare organizations. So one of the key benefits to healthcare organizations is scalability. How do you deal with the overwhelm when a pandemic occurs and there is an overwhelming number of patients and no healthcare resources to deal with them? So the cloud helps. The cloud can rapidly scale up or down. So solutions built on the cloud can scale up or down based on the number of users without a massive time delay or a massive cost increase. Cloud-based solutions help to optimize costs. So they reduce the investments in IT infrastructure, and through the pay-as-you-go model, what happens is that a sustainable scaling up can take place. Then improved security. When we look at on-premises systems, we've seen during our study that many healthcare organizations continue to store healthcare data on their premises, but using cloud-based solutions is more secure. And what other solutions that have been built on this are, for example, Clinarion is a Swiss-based provider of cloud-based anonymous identification technology. So what it has done on top of the healthcare data that the Korea University Medical Center already had was to help identify and de-identify patient data so that it could be used for patient data monitoring. So and analytics. So these kind of solutions built on the cloud provide more security than traditional conventional IT solutions. And then the cloud being something that is being constantly updated with new security patches, new technologies that are built on top of it, allows greater scope for innovation. And then finally, there is increased productivity. I'm currently working from home. I'm currently presenting from home. We've all been collaborating together over the cloud using, say, Office 365 or any such solutions. Now, all of these and how healthcare organizations are working together, if we take the same parallel, has all together increased productivity. And finally, I will present to you the benefits to patients. Now, patients, for example, there is the Health Hub portal in Singapore that allows patients to remotely access, schedule appointments, pay for healthcare. They can access their medical reports. Users can engage, patients can engage with healthcare systems, provide feedback to healthcare services. And finally, they can achieve what is perhaps most important, is the continuity of care. No matter where you are, if you are able to access your doctor from whichever part of the country you're in, your healthcare data is constantly updated. So no matter which doctor or which medical service you're accessing, they have access to the most accurate data that they need to assess your condition and treat you accordingly. So these are the benefits to the health systems. Now, I want to go to the audience today, which is healthcare startups, and say that you have a vital role to play in tackling these public health challenges. And what I want to share also is some of the findings from our report. Now, our report, while it was looking at policymakers, it was also looking at the innovation ecosystems within countries. And based on these, we've identified certain challenges that are relevant to startups. So, for example, right now, one of our findings was that people in general, whether it is policymakers, whether it is healthcare organization leaders, or if it is patients themselves, do not understand the benefits of cloud-based health tech solutions or even digital health. They do not see the benefits of these solutions as yet. So I believe that startups have a role to play even in creating awareness. They should partner with industry stakeholders. I believe some of you are here already. Partner and work with governments to develop solutions that can show the public and stakeholders who are concerned that these are perhaps not right for them, that these are the way forward, that digital health is the way forward. Secondly, one of the challenges that we've discovered is that many governments in the Asia Pacific region are still have a tendency towards, when they want to work with technology partners, they prefer to work with larger organizations, more established, and there aren't very startup-friendly procurement policies. So again, there is a chance for startups to strengthen their regional networks, to work with industry providers who are working in digital health, who are working in the infrastructure space, who work with other stakeholders who are working in the area of healthcare research and healthcare equity, work with them to lobby or perhaps approach the government to build more startup-friendly policies. Now, one of the key findings, and perhaps something that we came across time and time again as we interviewed people in these countries, was key decision makers in these countries were saying that there is this more misperception that cloud is less secure, or their digital health solutions have data privacy, data security issues. What I believe that startups also have a role to play here in first ensuring that their solutions keep up to date with the latest security standards, latest data privacy standards, and then in countries where the regulations are not in place, working with industry stakeholders and governments to develop these solutions, encourage them to perhaps build regulatory sandboxes, participate in these kinds of events and discussions so that once the regulatory framework is there, there is more confidence in health tech solutions. And finally, one of the findings that that came up was that digital health solutions are not working for many healthcare staff because they find them more time consuming. They increase their workload instead of reducing them. So one thing that would perhaps be worth considering is how intuitive, how user-centered is your solution? Will it increase the work of the user or will it reduce it? How do you provide training so that users can easily get up to speed with the new technology that you're offering? So these are my recommendations based on the study that we did. I'm happy to take any more questions if you have. Thank you.
Simine. Yep. Thank you, Robin. Thank you, Simine. That was a wonderful coverage on the ecosystem, cloud, and the recommendations to the starters. Oh my God, you were pitching cloud so well. I was really, really impressed. We're just gonna take a look at the Q&A chat, and I know there are more than a couple of questions there, but I am so sorry. Due to the time restraint, I think we won't be able to answer them like live. We will answer them later on during the event through the chat. So Simine, if it's okay for you, please stay a little longer to put in your answers in the chat. And if it's too much, you could just send it over to me so I could send to the question, the person who asked the question.
Sure.
Thank you so much, Simine. I hope I can see you soon. Yep, that's about it for the health tech keynote.
Thank you, Simine.
Thank you.
Thank you.
And with that, can the speakers for the next panel please join through the backstage? Rishabh is helping you as well. We're waiting for them to come on stage.
Yeah. So next session is startup panel. So you can actually hear from your fellow founders on their journey. And we have amazing 3 startups with us joining the backstage. Hi. Hi, team. I love this panel. Okay, so I'm just going to like run through who are here for us. Thank you, everyone. Rohit, Siman, and Shreyas. It is great to see you here. And everyone's okay on video. Cool. So we have Rohit Ghosh, who is a founder and a CSO at Cure.ai. We have Simon Lee, who is the CEO at Titus. And we have Shashriyaj Sundaraju, who is a head of clinical, products at Amelie. Guys, can you please introduce yourselves and business, product really briefly before we actually go on to the fireside chat? From Rohit, please.
Absolutely. Thanks, Gina, for that really nice introduction. And good morning, good evening from depending on where you're joining in from. I'm Rohit. I'm, as Gina mentioned, one of the founding members and the chief strategy officer at Cure. So at Cure, we built AI softwares that can interpret medical images like chest x-rays, head CTs, stress CTs, to identify diseases like tuberculosis, lung cancer, heart failure early on at a stage where it can actually be prevented and it can be intervened upon. I'll touch down upon more of that as we talk. And yeah, today we are present in close to 50 countries across the globe, almost across 700 plus hospitals. That's about me and Cure. I'll hand it over to Simone.
Awesome. Simon?
Hi, I'm Simone Lee. Hi, Gina. Thanks for the introduction. Good morning. I run Tigas Alliance Group. We are present across Malaysia and some parts of Southeast Asia. I run a banner group of pharmacies called Tigas. Essentially, our business is about Uberizing prescription and delivering digital pharmacy healthcare. And I've been in the business for 23 years, and we have several startups under our banner group. So over to you, Sharish.
Thanks, Simone. Hi, everyone. My name is Shreyas. I'm a medical doctor by profession, and I lead clinical affairs at Amelie. which is a precision gut microbiome company. What we do is we research on all the trillions of bacteria in the gut and see how they impact human health. We have a research arm that is working on making clinical applications out of the insights that we gain. Apart from that, we also have our consumer healthcare business, and we're building Asia's largest multi-ethnic cohort of microbiome profiles. That's what we do.
Cool.
Back to you, Gina.
Thank you so much. So now that we have kind of cultivated the ground, I'm gonna fire out the questions. So Rohit, I recently watched your TED Talk. It was amazing. And you were talking about AI being a big hero in fighting TB in India, which is the worst serial killer in India. And can you tell us more about how you worked with the superhero called AI?
Absolutely. Thanks, Gina. So yeah, this was a TED Talk I think we did almost close to 2-3 years back. But interestingly, just to explain what we do, I think the story that I narrated is possibly something I'll just sort of reiterate for everyone, just so that you understand what it means to have tuberculosis in India. And not only India, I mean, it's actually a big endemic in the Asian region. So we work in Philippines, Vietnam, Malaysia, a lot of places just sort of eradicating TB. So one of the SDG goals is actually eradication of all tropical diseases by 2030. In India, specifically, for example, tuberculosis, there's a goal to eradicate tuberculosis completely by 2025. Now, what is the problem that we are solving? So, for example, when there's a patient who's having cough and has to come to a hospital in India, which is a tertiary care hospital that's almost 200 kilometers away from their village, they're losing a complete day's wage to come there. And then they have their chest x-ray done, and they get their report 10 days later, right? Because chest x-rays are taken very often across every patient that come to these hospitals. And because you don't just have radiologists to read those x-rays, right? That takes so long to do that. And after 10 days, they're again called back to collect their sputum samples. And then possibly another day later, you actually get diagnosed whether you actually have tuberculosis or not. So there's a 10-day gap, I think 10 to 11 days where it takes patient to be diagnosed. That's a major challenge. Now, what also happens is because it's an infectious disease like COVID, the patient goes undiagnosed for 10 days and is spreading tuberculosis in the community, which is a bigger challenge to tackle a disease like that, right? So this is where AI comes in. Where it does is it sort of picks up those patients. Patient comes, now what happened after deploying AIs? Patient comes across, does the chest x-ray. Within a couple of minutes, you actually get an indication whether they're presumptive of TB or not on the x-ray. And you collect the sputum right then and there before they actually leave the hospital premises. So you're also not losing track of the patient, which is a big challenge in the Asian region as well, right? And you can actually diagnose patients within 2 hours, what it was earlier taking 10 to 11 days. So this is what we are doing with TB, but we are also now finding that same technology sort of also helps identify lung cancer early, because there are all these incidental signs of lung cancer or heart failure on the same chest x-ray. So that's what we are doing with AI, trying to eradicate tuberculosis as well as other disease areas.
This is awesome. You're getting like two birds with one stone, accessibility and scalability. It's awesome. Thank you. And Simon, you built a groundbreaking alliances for community pharmacy services at Tigers. I think you would have to like juggle online and offline platform at the both time. And can you tell us the story how you actually got the support from cloud to build that?
So when we started Tigas as a brand, we focused on building community and connections. So the fundamental premise of Tigas is basically a uniform banner group for independent pharmacies and mom and pop shops. Mm-hmm. And we saw this as a necessary need because of the great disparity in terms of purchasing power initially for independent pharmacies in Malaysia, although the large market size is made up of small mom and pop shops. So Tigas provided a community platform for that to happen. But as we progressed in the business, we found that what was happening to a lot of independent or community pharmacies in the suburbs or in their small little towns was that they were missing on the gap of communicating with patients. And this is where I think the online, offline, cloud support actually provided a lot of impetus, especially with COVID. We realized that the online platform, which is our online platform, which is Care Valet, provided a more integrated service to actually allow patients or people seeking help from pharmacies to come on board, and that our platform actually removes the complexity of dispensing and drug management. So our entry point for this startup, Care Valet, is really with corporates. So we've onboarded close to about 20 corporates in Malaysia. And what happens there is that we manage the claims as well as medication management for, something that Simran actually highlighted, one of the 4 challenges or issues in APAC, which is basically the rise of disease burden, which is NCD. So our entire business currently, from a standpoint of onboarding corporates, actually focuses on managing these chronic diseases. So from dispensing, we do patient engagement, we do care plans, and we provide a lot of access to our doctors and pharmacists as nutritionists and other caregivers for these patients to actually receive care. So I think COVID actually accelerated this, I would call, opportunity as something that I think Rohit has mentioned as well. It's presented itself in an accelerated mode in our business processes, right?
Yeah, and I think it would help with, like community building as well, which is essential for like healthcare in a way. And cool. So last but not least, Shiriyash. So Amelie recently launched a probiotic formulation tailored to Asian population. Very intriguing. So do you have any plan to expand that business outside of the region?
Yes, I think we are trying to democratize gut health in Southeast Asia first. The microbiome is highly geographically contextual. So people living in a certain geographic generally tend to have shared microbiomes. And so when we venture out of Southeast Asia and go further north, further south, we will start seeing that microbiomes change. And so a lot of the insights that we get and how we create these formulations are really based on what the microbiome of that geography really looks like. And just for context, when you measure a person's microbiome, which is dynamic in nature, which means it keeps changing, we get about 1 terabyte worth of data. So essentially, we are sitting on petabytes of data across different regions. And it is virtually impossible for one human being to actually look through all of this information, let alone gain inference and insights by just looking at it. And so, which is one of the reasons why we employ AWS's cloud technology to actually run some of our bioinformatics pipelines. And that's the source of a lot of our insights as well. And moving forward, we have started with Singapore because it's a very heterogeneous population, a nice mix of different cultures, different diets. And the funny thing we realized was that actually Singaporeans kind of share microbiome. It doesn't matter if you're Chinese, Malay, or Indian. We all end up eating each other's cuisines. And since diet is one of the major drivers, it looks like we have shared microbiomes. Similarly, when we did the research in Malaysia, we found that ethnic Indians versus Malaysian Indians, or ethnic Chinese versus Malaysian Chinese, the Malaysians had a common microbiome as opposed to their counterparts back in their home countries. And so this research is definitely very, very important and vital in how we target certain other things. So there are a lot of research going on within Singapore and within Asia on how drug efficacy or drug efficiency or drug selection is actually based off the microbiome. So that's a slow process, but it's getting sped up now thanks to technology that helps us look through data, vast amounts of data very quickly. So Southeast Asia, first step. To answer your question, we'll then go all the way to we'll go all the way to Asia, and then we're having talks with European partners and American partners and Australian partners, so which is very interesting, which shows the reach of the microbiome is very far and the interest is very deep as well.
Goodness, congrats and thank you. So we're meeting with a lot of early stage startups today, and I know Amelie was founded in 2019. Cure AI at 2016, and Tigers in 2015. So I think we could say your business is set for like certain focused path. But you must have had certain like difficult times when you actually until you reach that status. So can you tell us the story? What were the challenges and how you overcame it? Simone, can you start?
Well, I started Tigas in 1999. In 2015, there was a reiteration of the model to offer wellness services into corporates and patients. And I think the major challenge over the last 20 years that I faced you come up with one business model and you journey, and there's many reiterations of what the outcome is, and it's always a test and learn. I think in the last 5 years, and accelerated by COVID, I'm just going to focus on this. The major challenge would be looking at how to get prescriptions or scripts through pharmacies and fulfillment. I think the independent pharmacies or the community pharmacies at large, the mindset is still very driven by patient load coming into the stores, and because of the various lockdowns in the last 2 years, that's taken that away. And really, that major challenge has got somewhat of a help through the COVID and the presence of COVID. So what is that showed us is that a large-scale adoption of community pharmacies receiving e-prescriptions. That's one. Patients are generally more now open to consult online. That's two. Whether be it doctor or pharmacy consultation. And by the way, our model is not on acute teleconsultation. It's very much verification of chronic disease burden. And it's very much engagement with regards to managing this chronic disease. So that's two. That's really the openness for patients to engage online. And I think the third is basically putting together the infrastructure for logistics and fulfillment of drugs. We found this various avenues present itself over the last 5 years for us to do that. Previously, everybody was just dispensing out of the counter into the shops, and now there's a huge move to looking at, hey, can I get my medication delivered? And this is where the digital pharmacy play, and this is where we are focused on, Cabaret is focused on, which is basically heavily invested into equipping the entire system infrastructure with from offline to an online hybrid model. And although I would admit that it's not sophisticated at this stage, because the dynamics of dispensing is very much still in person, coupled with online kind of consult. Mm-hmm. So I think it's a journey at large. I don't think we've overcome that challenge. I think it's a learning process, it's growth, but I think cloud provides a huge growth multiplier for us. And I think that's something that I want to say. We've discovered that this is a huge support in terms of what we can do with regards to the business. And I perceive that this is really our, impetus to actually go into the region with.
Cool. Thank you, Simon. I think, there are a lot of hurdles, as you mentioned, but still, it's good to learn from your experience. And I think I cannot agree more. It's not about challenges. It's about the journey. And thank you. Shreyash, can you go next?
Sure, Gina. So I think my team has written something for me, but it looks like a lot of jargon, so I'm going to go off script. I think one of the biggest challenges that any startup faces, and generally anything in tech, it could be biotech, edtech, etc., is balancing revenue with research. And when I say research, it could be clinical research, but at the same time, it could also be product research. It could be any form of research that pushes the boundaries of what we're doing. And in this context, it became very crucial for us to partner with the right people to push the research, because Emily was founded by a bunch of nerdy clinicians, professors, and scientists. And so that was one of our core one of our core important pieces that we wanted to focus on. And so we were on a mission to figure out which would be the best way to do it. and the most cost effective as well as the most human capital effective way of doing things. And so to any of you here in the audience who are startup founders or focusing on doing things, focus on the things that you are, which is your core competency. Leave the rest out to people who are better than you at it. And that's more art than science. Really figure out partners who are available to help you. And that, I think, is the most important message, because every solution that you can think of that you want to build from scratch, there's probably someone who's done it better and more effective and more cost effective, right? So that's one of the key takeaways in my journey in the last 2 years, which is one of the reasons why we partnered with AWS to build out our cloud infrastructure, because it made a lot of sense. So find those solutions to focus on what you are best at. That's the key message that I would say, apart from the challenges that come along the way.
Cool. I really like the part about the partner, because, I mean, they say, like, if we go together, we can go far. So, yeah, great. How about Rohit?
No, I mean, it's interesting. If I had been speaking actually before Shreyas, I would have actually reiterated the same thing that he mentioned, which is about balancing the revenue versus research, right? I mean, I would possibly slightly put it differently. I think for us, the major challenge was that AI is sort of back in the day, 2016, 17, if we talk about it, it's a major hype, right? Everyone says they're doing AI in some form or the other. Actually, till today, it's sort of there. And there's a lot of noise around it. So people expect a lot of very over-promised stuff. I think there are a lot of people expecting AI can deliver things that actually I can't. At the same point of time, there was, with the clinicians and radiologists across different parts of the world, there was a lot of apprehensiveness, right, as to what the AI can actually deliver. Is it actually going to replace their job? And trust me, I have had those conversations where unions of doctors and radiologists would have shut down their labs, saying that we won't let you deploy AI at different places. So there are a lot of those stories that have happened in the past. But that was a major challenge. How do you convince clinicians that there's specifically radiologists, that this is something that is actually to add value to their job, to their patients, and to the overall healthcare ecosystem, right? To the government, right? And convincing that was obviously a difficult challenge. So I think the lesson that we learned from there, which might be very important, and which is sort of, I mean, iterating what Shreyas already said earlier. For us, it was just about understanding who is that value proposition to, identifying those first 10 people who are going to pay for the solution, and what is that value that you deliver for them. Because fortunately or unfortunately, in healthcare, health tech ecosystem, a lot of time clinicians and they might not immediately realize the value that a health tech solution provides for their patients, right? And it might not be sometimes also in their best interest. So to understand who is that stakeholder in that entire ecosystem who can actually benefit from the solution that you have is very important, and sort of identifying those first 10 people who are going to pay for it is very critical, right? I think that was one thing we learned. And obviously, if it comes to cloud, I think one of the major key challenges is how do you work with governments, right? A lot of work that we do is, for example, in tuberculosis, right? And that's a major government goal in all countries that we sort of are present. So to convince government obviously takes a lot of effort. And as a small startup, it's very difficult to do that. So working with a partner who can actually take that solution to governments and help that, instead of you doing that, again, as Shreyas was mentioning, you can only do as much, right? You can, you better partner with people who have already done that and have that network to help you out. So those are, I think, the two key messages that I would say for every budding entrepreneurs out here in the crowd.
Right. You know what? You accidentally answered one of the questions in the Q&A chat, which is about like pitching. And seriously, the three of you have been sharing wonderful stories, and I really have hard time keeping the time on. So sorry, we'll take the questions offline. I don't think we'll be able to answer them live right now, but
we can take one.
We can take one? Okay, thank you so much. So I'm going to take a question from Hugh to Shiryash. How do you balance between the right amount of time and allocated to R&D versus productivization? Oh my God, this is a very difficult question. Shiryash, do you have an answer for that?
You've asked me a very, very difficult question to answer in a very general way, but it's a lot more art than science. the good thing or the lucky thing with us was that a lot of our early investors were also clinicians and scientists. And so they understood the value of research. But at the same time, we also understood that for further rounds of investment, for example, you need to show some traction. So we took the quick wins, what was the most immediate needs in hospitals or on the consumer front, and we went ahead with it. And as the science evolved, we got a lot better with with our productization, as well as focusing on the right areas of research. So it is, I don't want to use the word it depends, but I think you have to weigh what is more important for you. Is your runway more important for you? Or if your runway is not important and your product is very, very close to fruition and you already have a ready buyer, then you can afford to spend a little bit more on R&D because you know your product is coming in very, very quickly and revenues are around the corner. So maybe we can take this offline here and have a chat about it, because I think it's a very interesting question and you are a health tech startup. So I would probably like to take a look at that and have a conversation on that. But yeah, very interesting question. I hope I gave an answer that's not too confusing.
Right. I think we can change that. And with that, I'm afraid that you're seriously. Come on.
Whenever I show up, it's time.
You're like, yeah. Anyways,
Can I get one word in since we're here? Public service. The importance of gut health is so much emphasized today, and I would implore all of you here on this call today to go get your guts checked or take a hard look at your diet, because a lot of the diseases that we're seeing are really, really linked with diet and your microbiome. So a healthy diet and a healthy mind gives you a lot more than the quick gratification of having that ice cream or that steak.
So, founders, this is how you pitch. Okay, thank you so much, three of you, and I am definitely looking forward to working with you more closely to support to your continued journey. And thank you again for all the questions, and we'll make sure that your unanswered questions will be answered. And over to you, Robin.
Thank you, Gina, and thank you, everyone, speakers. For the first section of this program, we made a slight change to the program. We were going to go to virtual networking now. We are for 5 minutes, so that's 1/3 of the time that we promised you earlier. That's to get a little bit back on schedule and make sure that all the speakers are available. We'll go offline here centrally for 5 minutes. If you want to go network, please do so. When this session ends, you will see the tables again. You can sit down, talk to each other. But it will only be 5 minutes. Don't worry about the networking. There's going to be another session at 12:10, and all the way at the end of the program, there's going to be at least an hour for whoever likes to network online. Again, all speakers so far this session, thank you very, 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 very much. We're back in 5 minutes.